Here we go.
Here we go. Talking about all things access to care.
Yes. Yes. I was just for our viewers, I was just telling Natalie that I'm coming in hot today and super activated because I just started to work with a client who I haven't seen in a long time. And I'm so glad that I can work with her, and I'm so glad we can get her the things that she needs. But she's only able to access those things because she has money, and that makes me insane. Yeah, accessibility therapy just makes me absolutely, the whole system makes me absolutely insane.
Yeah. And I'm coming in a place where I started my new job. And so I'm saying goodbye to long-term clients. And there's, at least one client in particular who has a particular kind of insurance and has complexities in her clinical presentation. And it's really hard to find a good fit provider for her, right? And so I feel so torn because I know that I can't continue to see her and provide the kind of care that she needs, and that she has to in some ways settle for someone who maybe doesn't have competence or expertise in her clinical presenting problems, or or go without care. It's such a bind, such a bind. And doesn't seem to be getting better in some ways, though in some ways it's more accessible because of different platforms that have come on the scene in the last couple of years that offer virtual or talk or text or whatever, but it's still, that I guess is the dialectic of the both and. Like in some ways, mental health therapy is more accessible than it ever has been.
Right.
And in other ways, the system is significantly messed up.
So messed up. And in the ways that it is more accessible, feels like so many of these other things that we talk about, where I'm constantly talking with people about, we often get stuck when we're stuck in this box, this like oppressive system, whatever it is, a societal oppressive system, our family system, our internal, whatever it is. When we're stuck inside this oppressive box, we can only make tiny little adjustments that just tweak things. And so we're like, oh, I made this change, but I still don't feel better. It's like, well, yeah, because we moved your elbow a couple inches. You're still in this box. How do we fundamentally change the box? How do we fundamentally change the system? How do we knock down the walls to give ourselves more breathing room? Because as long as managed care is still calling all the shots and dictating the terms, then telehealth is a tweak to a system that is not changed virtually at all and doesn't make a profound difference. In some ways it does, but the system that is causing so many problems, it doesn't shift almost at all. It's like the panic trying to turn, right?
Yeah, absolutely. Yeah, I feel like the pandemic in some ways like made us evolve, made us do things like telehealth as like a normal routine procedure. And yet, at least in the state of New Jersey, at the end of this year, something expires that creates equity between telehealth and in-person visits. So it's possible that in 2024, reimbursement will be lower for telehealth sessions than in-person sessions. And so like that kind of thing of like, I get the logical reason why they might think we can reimburse less. And yet that's what makes the system like start to really get messed up. Like, because if that actually happens, then like all of that stuff and like providers are not going to get reimbursed properly and like all these things.
That's right. We're already seeing some of that in Illinois. Our governor signed telehealth parity into law, I think in 2021. So thankfully we've got that covered, but there are certain plans that don't fall under that jurisdiction, right? And so we're already seeing some of those changes taking place where telehealth is being reimbursed at a lower rate with certain plans and certain insurance companies. And it's enraging. But it's also what I was just saying to you before we started is I just also get really frustrated because the way that we tend to talk about this as a field, the way that therapists talk to each other about this, especially white progressive therapists, tends to be from this, well, you individual just need to do better. Are you accepting Medicaid? And if not, shame on you. Are you doing pro bono and sliding scale? And if not, shame on you. And does that help create or increase access? Absolutely. Absolutely. I see three people. One is Medicare, one is pro bono, right? That's something I believe strongly in. That's something my practice believes strongly in. But why are we attacking each other as individuals? Why are we hoping the solution lies at the individual level instead of banding together to work towards systemic change? Because that's the only way that we're really going to make a long-term impactful difference, other than like one-off people. And every life matters. Like we want to work with these one-off people where we can make a difference in their lives. And we need systemic change. But that's hard and that's intimidating. And that makes us feel hopeless and overwhelmed. So we don't do that. So much easier to attack one another and get on moral high horse than do that.
Yeah. It makes me think about just how individualism, right? Like that characteristic of white supremacy culture of like that just individualism and capitalism, right? Like is like we want to make more than a living wage. We want to be able to practice self-care. We want to, do practices that sustain us over a long period of time. And it takes effort and energy to collaborate with people to try to disrupt oppressive systems, right? And even if I think about my own personal journey of this, like I remember maybe the last presidential election, I remember talking to a Black colleague, also a psychologist, and he was really promoting this idea of like, I don't know if it was like Medicare for all or like something that was like more universal.
Okay.
And I felt like ignorant at the time of like what the benefits were for like the complexities of all of it. And I think how many of us can be ignorant about like how do some of these social programs or social policies that that are difficult for societies to adjust to or embrace, how they are helpful for these kinds of cases we're talking about, right? And that for the people who the system works for, right? So you talked about your client, right? Like she has financial means that support her in getting the kind of therapy that she needs. And yet, what about all those people who don't have those financial resources, who can't afford to pay out of pocket, who can't afford to copay, who don't have providers nearby them, all of those things. And I think about how it's really hard for us as a society in the United States anyway, to think about like, how can we take care of each other?
Yeah.
What are like innovative ways that we can create programs? And it's interesting because I hear about some of these like boutique medical providers who like are leaving, let's say, managed care systems and creating these boutique things where you like pay a fee. I don't even know if it's annual or monthly. And with that is a package, which in some ways sounds great. And in other ways, it's like, well, who gets to access that? Right? And who can access that, who can afford that? And it's like, I love the way people are being entrepreneurs and figuring out like what works for them as individuals. And what about everybody else too?
What about everybody else? And direct primary care, I think is what you're talking about, where they subvert insurance companies entirely. There's no insurance. You don't use insurance. And that is lovely because we don't deal with insurance, but it also, again, doesn't do much to improve access because it's only folks who have the means to do that. But that's what I've been sitting with. It's so funny you say that because I've been thinking about, is there a way to use the direct primary care model for therapy.
Mm,
And it's hard because therapy is so resource intensive, money,
yeah.
time, etc.
Yeah.
So there's no way to directly apply it. But that's where I can get excited, because I'm like, I can use creativity and community care.
Mhm.
How do we use creativity and community care to subvert the system and increase access? And I think, I don't know, that's the only thing that gets me excited after these last few weeks of rage about this. Like, if we can be creative and work together to increase access, now that's cool. That's my jam.
Yeah.
Uh,
Yeah.
that sounds a lot. I can get behind that in a long-term way that I just know about myself is hard for me to do if all we're talking about is how do we dismantle managed care. That gives me a ugh.
Mhm.
Getting creative about community care and increasing accessibility by subverting managed care.
Mhm.
Let's
Mhm.
talk
Yeah, that
about
would be
that.
amazing. Yeah, it'd be
Yeah.
amazing. And I keep thinking about because I taught this history and systems of psychology class earlier this summer, which got me to learn about parts of psychology I didn't know about. But like what was fascinating was like after World War II, not after, like during World War II, when the US government knew that there was probably going to be a lot of trauma that was going to be, embodied in the veterans that returned, they like put lots of funds into getting psychologists trained and getting them paid to provide the social
Fascinating.
network, right? And that psychologists by themselves wouldn't have advanced as far without that federal government subsidy, right? That's how like training programs became. That's how lots of psychologists got trained. They got like the VA system and other programs because they just knew. And I think about like community mental health centers, like the initial design of like community mental health centers. Like we have to have social programs
Yes.
that say like mental health is important in our communities and we're going to pay for it.
Yes.
So that also you get, I think about like systems I've worked in that, take a wide range of insurances or Medicaid, whatever. And it's often the people who are inexperienced in the field who are predominantly in those systems
Yep.
because of the intensity of labor that's required, the pay, all of that stuff. And yet I know that seasoned clinicians or even mid-career clinicians would work in those systems if it was more sustainable, there was less burnout, and they got paid more, right? And so just thinking about like those are, I'm always battling in my mind, what do we have to blow up or subvert, right? And where do we need to just have a seat at the table to be able to be there to have those conversations, to figure out how it can be done differently?
Yeah, can you, I mean, I know why you chose this new job. Is that something that you would be willing to talk about here?
Yeah. I mean, yeah, part of some of the things I was thinking about this past like maybe 6 to 9 months was, do I want to go back to work in a predominantly white institution full time? And or do I want to go to like a historically Black college or university? Or do I want to, just remain as like a self-employed and entrepreneur? And, I could have gone either way, but part of the reason I was drawn to a predominantly white institution, particularly like a university, is, if 30 or 40% of the students are people who tend to be minoritized, particularly like racially minoritized, they need people who look like me, people who have some of my identities at the table, right? We need to hire more staff and counselors and psychologists who look and represent them. And if people who look like me and identify with me keep leaving or not entering into those systems, they stay white, like super, super white, middle class, upper middle class. And all those first generation students, all of those who come from historically minoritized or marginalized groups, like they come to those systems and they experience almost immediately that this place wasn't built for them. It was never designed for them to be there. They experience all of these microaggressions. I think about all of the trauma-informed care that needs to happen throughout people's entire college process. So like, that's what gets me jazzed up about like returning to a predominantly white institution, particularly at a director level. It's like all the things I'm imagining, like that could train the staff, could train the collaborators on campus. Like we could truly be co-conspirators into helping students thrive who are of all kinds of identities. Yeah.
I just love that so much because it's so creative about the kind of impact that you want to make, right? It's getting really clear about the kind of impact you want to make and doing it in this really creative, nuanced, messy middle kind of way, which I don't think gets as much airtime these days.
Yeah, absolutely. And yet I wouldn't have gone to any predominantly white institution, right? Like they had to have a curiosity that things could be different. Like, how could we actually embody anti-racism and anti-oppression? Because I didn't want to go to a system where they're like allergic to even the language of anti-racism, right? It doesn't matter where you are on the journey, but if you're curious, if you can even use certain language, or even if you're just really relational, even though you don't exactly know how to make your place more diversified or more inclusive, or historically you've catered to a particular demographic. And so I think like that's the thing is like you have to have done enough work to get people from marginalized groups to want to come and work there and stay there. Otherwise, you know, people like me, like we burn out, right? We experience harm. Right. It's soul crushing if you don't have the right supports there.
That's right. So for anyone who will listen to this and hear and get it twisted about like, oh, I should be martyring myself, because I know that's not what this decision was for you.
Yeah, not at all. Yeah.
Can you talk? I'm sorry, I'm turning this into an interview. Is that okay?
Yeah, that's fine.
Can you talk about, again, I've had a glimpse of this, but I would love to hear more about like your process of discernment for this is a situation that might be activating at times, that might be hard at times. And I'm balancing it with X, Y, and Z because these are the things that fuel me. And like, I know it's just this really intentional decision, not one of like, I need to fall on a million swords, which I think this field is especially guilty of sometimes.
Right. Yeah. Like the rescuer or savior kind of. Yeah, I definitely don't have any of that in me anymore that I can, on a conscious level anyway. Who knows what's unconscious? But I think for me, my discernment process was, you know, doing so many hundreds of hours of anti-racism trainings over the last couple of years and thinking like something is missing. Like I miss like being in systems where you're collaborating with people on a daily basis, like you're building those relationships, and then you can feel like the creativity, the implementation of programs, things like that. So I went on a bunch of interviews and there are vibes to different institutions. Like you can tell like who, like even in the interview process where it felt unidirectional, like it was like them asking me questions, of course, but it didn't feel like it didn't feel like you were convincing me why I should come to you, right? Like, what's so great about your system that I should come? I have lots of talent, so why should I come to you? Right. And then I think there were ways in which the institution the university I decided to go with, that even the vice president, like just was like so relational, so caring, a white woman who was able to name that she was a white woman, right? And that there was work that needed to happen on campus, which to me was like, all right, great, yeah, all right, you know you're white. Yeah, and like even just talking to different people on campus, and I think about like, if I feel like I can't use certain language because you're too fragile, then like that's, I think, problem. But it's interesting. So I was having lunch with some of the team on my first day, and I could feel a little bit of the censoring with just one question, which was like, we were talking about books we've read recently, and they were like, oh, I said I read like about a book a week, and so they were like, oh, what's a great book that you've read recently? And I didn't disclose what it was, because the book
was
that
all
it
those
was,
white friends I
friends I
brought.
couldn't, yeah, all the white friends I couldn't keep. And I was like, this is day one. This is a little too soon to be dropping this title, because the title is provocative in my mind.
Yes.
And so it's
Intentionally
like,
so, right?
right, yeah. And so I'm like, I totally, in a couple weeks would totally mention it, but I felt like on day one, like maybe, so I feel like there's a difference between like censoring and I'm not going to really share it, and we have, versus like we're still building a relationship, and this is going to come out of context, right? And I don't have time right now to explain what all the things about this book, even though I'm like really committed to anti-racism. So I feel like in my relationship with white people in particular, I'm fine with doing that for a time.
Sure.
But I don't want that to be our relationship. And I've worked in plenty of systems where that was the relationship, is I take care of white people and they don't even know I'm taking care of them. And I don't want that to be replicated anymore. So for me, and I think also for me, it was like, what will this institution give me that I don't already have? Right? Like, will it give me more financial security? Will it give me like more paid time off? Will it give me like legal relationships I really value? Like, can I feel like I'm leaving a legacy? I think a lot about how can I be a good ancestor, right? In this like second half of life is like, how can I be a good ancestor? Like, what am I leaving behind for the collective? How can I make this world better? My kids will be going to college maybe in like 3 to 5 years. And like, how can the systems be better?
Absolutely. And I just love the intention, the creativity, the deep reflection about what you need, not even on a surface level, right? Like what your soul needs, what you, And I think that all that I would love, if anybody takes anything from this conversation, I hope it's inspiration that like we can do this work of collective liberation in a million different ways.
Yeah, absolutely.
Right?
Yeah.
And that it doesn't have to be this way that gets a lot of airtime and is valuable, right? But there's so many options, and there's so many valid options and options. Like, so I've been thinking about therapy, right? And it's like, what are the accessibility issues? And it's like, it's hard to find a good provider that meets all your criteria, that takes your insurance, that's taking new clients, that has availability.
Oh yeah, all the things.
All that, right? Like that's so hard. And that's even hard for people who have like the best case scenario in terms of resources, right? PPO, whatever. They can do a noon appointment because their job is cushy and But then, like, even once you're in the payment situation, because even if you can find somebody who meets all your needs, it's like, but then that assumes you've got to be able to afford your premium, afford your deductible, afford your copay and co-insurance. Like, how many people do we serve where we're like, I've got Blue Cross Blue Shield PPO, but my deductible is $5,000, and like, which means I'd be paying what, $150 a session almost the whole year and never even use my benefits? No, thank you.
Yeah, absolutely.
So like, we could think about what are all the problems embedded in those two accessibility problems, get really thoughtful about that, and then you pick which one you want to work on. This doesn't have to be staging protests for Blue Cross Blue Shield.
Yeah, absolutely.
I'm picking at them a lot, but like it can look so many different ways, but because so many of us aren't awake, myself included sometimes, and we're just like doing all the things, the quickest option is to like get pissed at your employer or your colleagues about how they're not doing their part as an individual. And like, I want to wake people up to this.
Yeah, absolutely. I even think about just psychoeducation, because I think about, even if someone is employed in a system that offers benefits, how much psychoeducation do people get about the different plans available, right? It's like, if I pay less per pay period, that might be good because maybe that's good for my budget. And yet that might mean I pick a plan that has a higher deductible. And so then when I actually want to access services, I'm going to pay then because it's going to take me a while to hit my deductible. So I even think about like some of that language, right? And the ways in which Affordable Care Act is supposed to be helpful. And it is in some ways, but also still it's expensive for a lot of people, right? And then so many therapists opting out of insurance because the way that the managed care system is built is a lot of admin stuff that can be a headache.
Right.
And then these other systems that are coming into place that I guess are like venture capital subsidized kinds of things that help, I guess, solo practice clinicians be able to subsidize, or like they do the admin part of that. So like, which is good in some ways for the solo practitioners, but not so great for group practice owners, or like long-term consequences in our field, right? It's kind of like what in the short, it's just kind of like managed care in the short run, it's a great invention. But as it takes root and becomes like the monopoly or the majority thing, then it starts to shape care versus being supportive of care.
100%. And it's still operating from this model of managed care, one-on-one sessions every single week. Yeah, so I'm just, oh man, I really want to figure that out, how it can be less cost prohibitive and less time intensive, so that it's not therapy per se. There's no replacement for therapy. That's the thing, good and bad, right? There's no replacement for a one-on-one long-term relationship with a provider. But if you don't have access to that for a million really valid reasons, there's got to be something else. There has to be something else. And
yeah, it makes me think of like groups, workshops, like preventative stuff, like community organizing and engagement. Like, how can we build communities of care that, you know, I think about like therapy in terms of like the kind of therapy that everyone should have access to, and some of the ways in which sometimes if we treated each other better and supported each other's vulnerabilities and mental health and bodies and all that stuff, there would be less of a need for certain kinds of therapy. And so like, how do we do both, like the intervention part, but also the preventative stuff? So like, what do we need to do across the lifespan? So like before even babies are born or conceived, what are the ways in which we need to provide education and social emotional learning and emotional intelligence, like all of that stuff? And how do we dismantle rape culture and misogyny and misogynoir, and like, how do we treat everybody like their life matters from the very beginning?
The very beginning, yes. And that's the other thing that's been pissing me off about therapy, is that there's so much gatekeeping, right? The whole way. Like, who can get into these programs that are hundreds of thousands of dollars and take 5 or 6 years if you're considering fellowship, right? Who has access to that? Who can do that? Not a lot of people. And then through, like, we're going to an expert to fix us, which again can real healing happen in a one-on-one really? Absolutely. And it doesn't have to look like that gross expert fixing a broken person. And there's so much good information that therapists have, but individuals only get access to it if they can afford to go to therapy. It's like, how do we dismantle all the barriers so that we can get this information out to folks, regardless of whether they can pay to be in a one-on-one individual therapeutic relationship? Because that's all that stuff that you just named. Like, oh my God.
Yeah. I'm curious about, I don't know what you're calling it. It's fairy something.
Oh,
Uh,
sorry.
yeah. So tell me more about that. Cause like, that seems like that is like being grown out of this need of like helping people be able to get paired with someone who will be able to meet their needs.
And I'm so, my toxic trait is perfectionism. I've been feeling so, it's part of my rage because I feel so discouraged by it because
Hmm.
finding a good person, like a good therapist match, right? It's such a small part of the problem. Like, so therapy very helps to like connect people, so they don't have to do all this. I mean, it's tremendous labor, as you well know, right? It's tremendous labor to find somebody, especially if you don't have Blue Cross Blue Shield PPO, or it's not just depression or anxiety. If it's something really niche or specific, like
Mhm.
it's a nightmare. And so I feel good about that. But the money piece, it is just tweaking
Mhm.
the same system that doesn't
Yeah.
work for what, 90% of the population.
Yeah.
And so that's been part of what's my experience with therapy fairy. It is part of what's informing my rage, um, around this bigger issue of accessibility, which is money. Um,
Yeah.
and it's just so expensive,
Yeah.
so expensive.
Yeah.
So yeah, it just doesn't, it's like, it's just not, it's something I'm happy to do,
Hmm.
but
Right.
enough,
Yeah.
enough.
Yeah. I mean, I think about like when we have this creative energy and we create this thing, and then we discover, like, we peel back the layers of the onion and we see, like, oh, okay,
Yep,
like the
that's right.
problem is bigger than this, deeper
Right.
than this, right? And so I think about, like, how do we get the right people in the room to be like thinking through this stuff and mobilizing into action, right? Like for me, I always like want to leave these conversations with like this idea of Mariam Kaba's like hope is a discipline, right? So like how do we build hope together, right? And thinking about what can we leave our listeners with of like different ways that they can engage, whether they're a therapist or not a therapist, about there's so much work to do,
Yeah.
right? And people at the new system have been commenting on my email signature, which says, may you sprinkle kindness wherever you go, right? And like for me, that's like the basic contribution people can
That's
have
right.
in society, right? Is
Right.
kindness, like in customer service and people who annoy you, like how can we just be kind to each other? As like we might like undervalue how kindness like could change someone's whole life, right? Especially some people who almost never get kindness. They just get a lot of brutality.
Yeah.
So I think about like, that's to me like the basic entry point is kindness. But then I think about there is value to therapists doing pro bono or sliding fee stuff,
Right.
right? And like getting paneled on insurances. And I think it's like, and that it's never going to be enough,
No.
right? And that doesn't mean we don't do more. It just means like we keep going, we rest, we keep going, we
Right.
keep figuring out like how complicated the system is. And we start in our circle of influence,
Right.
right? Like what can we do in our local communities to build community care?
Right.
Like have people have like, if I think of like Maslow's hierarchy of needs or other cultures who have like how do we get people to have their basic needs met? How do we embed trauma-informed, trauma-responsive care everywhere, from our school systems all the way up? And like, how do we realize that everything is political? Everything is political.
Right.
Um, and if we think that it's something is not political, we're not awake,
Right. We're missing
right?
something.
Yeah.
Yeah, we're missing something. Yeah, absolutely. You're right. And the both and is so important there. Thank you for bringing it back to that, because I don't want anyone to hear me saying that like we shouldn't be doing that. We should be doing everything in our power, of course. And that cannot be where we stop,
Hmm.
right? Like that we need to be doing the best as individuals, but also working with one another to get creative around things that, I feel like we're going back to last episode where we talked about like what creates joy. And I feel like there's a big hole in this work there. It's like, that's how we stay in it in the long term, is when it really truly brings us joy. Because if we're doing this as martyrs, right? We know how that ends.
Yeah.
If we're doing it for brownie points, so what can we do that feeds us? Because that's how we can do it in the long term. It's reciprocal, and every healthy relationship is reciprocal, period. Except maybe parents and children, but
Eventually, maybe.
Yeah,
maybe it flips.
One can hope.
Yeah. It makes me think about how we have to get proximity with some of these communities that we're noticing don't have access. Because I think about sometimes we can have this like savior complex, right? And we're not actually in proximity or having relationships or listening to those people most negatively impacted by our existing systems of oppression. Or the way people currently access services, that they might need something different than we're thinking about, because they have a different perspective. And I think about how do we get those relationships? Like, part of what I do in anti-racism is that when I'm particularly with therapists, is I want to train white therapists to be able to work with people from marginalized racial groups, because they're just not enough.
Right.
Black, brown, indigenous, Latina, multiracial, Asian individuals who are therapists. Like, it's nowhere near the 40% of the population. So this idea of like cultural competence, right? How do we get more providers to provide care? Because sometimes our clients can access care, but the care they're getting is not culturally competent, right? And that's causing them more harm as well.
For sure. That's been part of one of my clients that I'm working with needs a higher level of care, and she identifies as a racial minority, and she's experienced such poor care that she feels like is racialized poor care, right? It's because of a lack of cultural competence or cultural humility. And it's so even though she has the means, right? There are then barriers because of her experiences, because she can't work with anybody who looks like her, who she feels like really gets her. And I don't either, but we're working on it. So but coming back to hope.
Yes. Let's leave with some hope. Yeah.
Coming back to the discipline of hope.
Yeah.
It's cool. Where I can land is in creativity, about how do we do this in a way that can benefit the most people possible. Maybe I can talk that through with you some other time here or something else, but
yeah, absolutely. Yeah, I mean, I think for me, it's like me switching into this different system is like me trying to practice, like, okay, how do I pivot in a way that is like nourishing to me spiritually? And time will tell how that will unfold. But I love how the creativity is coming already. Right? Like, the ideas are like spinning around in my head, and I'm like, slow down, right? And that feels great to be embodying that kind of energy again.
For sure.
Yeah. And like, I guess for me, like, my parting message is like wanting to inspire people to, if you can, take a leap.
Yes.
Take a leap. Do the thing that scares you. Get outside of your comfort zone. Make connections with new people. I think, like, sometimes people say, like, I read a lot of depressing books, but like the nonfiction books that I read that teach me about the history of oppression in the United States, helps me to understand how deeply rooted all of this is, and helps me connect to grief and rage. And that rage that you're talking about, that I'm talking about, like that mobilizes into action.
Activating.
Right.
Yep.
And I get that it could also put people into despair and depression. Right. And like being immobilized, paralyzed, and yet it can also be channeled into change.
Mm-hmm.
And so let's
It
do
is
that.
Especially when we're doing it together, right?
Yes,
Because
absolutely.
we can, if somebody's in despair, then it's likely that somebody else is in a different place and can pull them out. And we need to do this work in the collective. We cannot do it individually, which is one of the things I love about this, so that even if people don't have a Nathalie or a Colleen or like this in their life, at least they can come here and listen to this and have these conversations in their own head with us, and hopefully more out loud someday. So
absolutely.
that camaraderie, right?
Yeah, and that we can hopefully combat like the great loneliness that exists out there. Right, like so many people are lonely and feeling isolated, and we need those relationships to heal and to thrive.
Totally.
Yeah.
Good stuff.
Yeah. Nice chatting with you as always.
The same. Talk soon.
Bye.
Bye.